Are you currently suffering from pain on the outside of your hip that's made worse with such activities as stairs, walking, or laying on that painful side? If these symptoms sound like the pain that you're currently suffering from, there's a good chance you're suffering from something called gluteal tendinopathy, which is more commonly known as gluteal tendonitis or Greater Trochanteric Pain Syndrome. My name is Dr. Zach Greenwood, and in this video I'll be discussing how this condition commonly presents, who most commonly is going to be affected by it, some really important positions, activities to kind of modify to let those tissues calm down, and then the best rehab and strengthening exercises to help fix this condition in a permanent capacity. If we look at this model, this is our spine, this is our pelvis, and then this is our hip joint or our ball and socket joint. And on the outside there's a bone part that's called the Greater Trochanter, and this red band represents your gluteal tendon, so it kind of lays over that. And there's a bursa under there, and these are important structures that can cause your pain that we'll discuss in more detail later. Gluteal tendinopathy comprises about 10 to 20% of all people suffering from hip pain, so it's a pretty big deal. And it most commonly presents as outside of the hip pain, but it can radiate down the thigh, into the front or groin area, or into the back of the buttocks area. It's most commonly seen in women between about 40 and 60 postmenopausal range, and risk factors such as wider pelvises and smoking can be effective. The pain will be aggravated with such things as prolonged sitting, climbing stairs, laying on the effective or painful side, and then single leg loading exercises such as running, jumping, or lifting. With this kind of pain presentation, it often gets diagnosed as gluteal bursitis. And we talked about earlier that bursa is in between the tendon and the bone, so it can cause pain. But you got to think to yourself, why is that bursa irritating in the first place? And a good analogy here is if you have a fever from a bacterial infection and you only take Tylenol, it will help reduce your fever, the symptom, but you're not actually addressing the underlying cause. And the underlying cause here is bad mechanics of that gluteal tendon, the tendon getting excessively compressed against the bone, and then bad mechanics causing that bursa to get irritated. So if you don't change those things, you're not really going to fix the problem long term. And so if you have pain in the hip for 2 years, it's not gluteal bursitis, and you have to strengthen the tendon and the muscles and remove those positions. Related to those positions, we're going to tell you why you need to stop stretching your hip if you're suffering from this. So back to that model, this is our gluteal tendon, and that's that bone. When tendons get irritated, the two things they hate are tension and compression. And when you're doing hip stretches, you're doing those exact two things. You're tensing the tendon and compressing the tendon, as well as irritating the bursa. So these stretches that we show you right here, if you're doing them, you need to stop right away, and you're going to feel a lot better in a few days. So next we want to talk about some positions that you need to temporarily avoid or really modify, because again, they're placing tension on that tendon, which can cause further irritation. And these activities mostly are loading or bringing your leg across midline, which is adduction. For sleeping, it's best to sleep on your back with your knees slightly bent with a pillow underneath your knees. The second best position is to lay on the non-painful hip with the knee supporting between your knees. And then lastly, if you must, place a pillow underneath that painful hip. With standing, we want to avoid leaning into that hip, especially the painful side. Here the green check shows you what you should be doing, and the red X shows what you shouldn't. With sitting, you want to avoid prolonged sitting, especially when your legs are crossed. With walking, we want to make sure that your feet are shoulder width apart and not crossing midline. Here we show you the incorrect form of letting your foot come too close to midline or crossing over it. Lastly, with stairs, we want to keep that pelvis level. You want to use one or both arms to help stabilize your pelvis so it doesn't tilt. Here we'll show you how to do it with the correct form with the green X and the incorrect form with the X. We're going to show you some great level 1 exercises that strengthen that hip and reducing your pain. And it's easier to do this in a seated position or a standing position. So in a seated position with our hips and knees at 90, we want our feet wider than our hips. And then using your hands, you're going to place on the outside of your knees. And then we're going to press our knees out into our hands and hold for 5 seconds. We're going to relax and do that 10 times, once or twice a day. As you're doing this, you want to feel tension on the outside of your hips. You can also do this with resistance band. We're going to do one set with our feet neutral, and then we're going to stagger left foot forward and do the same thing, and then right foot forward and do the same thing. For the standing version, we're going to use our glutes to try to push our feet outwards and rotate, but we're not actually going to rotate. It's going to be isometric. So we're going to put our hands on our glutes, and then squeezing your glutes, you're going to try to rotate those feet. Again, hold for 5 seconds, relax, and then repeat 5 to 10 times, once or twice a day. But again, you want to kind of feel like your feet are trying to rip that floor apart, and you're feeling your glutes engage. Now we're going to show you level 2 exercises, and we have a printable PDF. So in case you want to just print off so you have like a reference, you can just look in the detail or comment section and it'll be there, there'll be a link. So for these exercises, the goal is to increase the intensity of that exercise and strengthen the tendon over time. So each week you want to do more challenging exercises than the previous week. And I'm going to give you several different versions, but again, you want to kind of tailor it to yourself. But again, each week you got to do more than the previous week. With the glute bridge, we're going to lay on our back with our feet even, and then using our hips, not our back, we want to raise up in a slow tempo. So we're going to go 1, 2, 3, pause, 1, 2, 3. We're going to work up to 8 reps in this position, but again, it's better to go slow tempo and do 2 reps if that's what you need, than do more at a fast tempo. After we do that, we're going to rest for 30 seconds or a minute, and then bring our right heel all the way back. And then this position, we're going to raise up slow, 1, 2, 3, pause, 1, 2, 3. When you're doing this, make sure you keep your pelvis level and don't let it tilt. One thing to note is when your heel is back on the painful side, it's going to be more challenging. So let's say if my left hip hurt more, this side is going to be harder. So when I go up, I really want to make sure that my pelvis doesn't fall down. So as we do this, we'll go 1, 2, 3, pause, make sure you have good form, and then come back down. To increase the difficulty, single leg bridge. So bring one leg up, keeping our pelvis square, we're going to raise up 1, 2, 3, pause, 1, 2, 3. Again, tension over the glute, 1, 2, 3, not the back, pause, 1, 2, 3. We're going to do squats. We're going to need a bench or a chair to sit down with your arms straight forward and our feet normal. We're going to squat down, 1, 2, 3, pause, up, 1, 2, 3. Make sure it's the glutes, not the back. We'll do that up to 8 reps, and then we're going to stagger. So right foot back, do only 4 reps of these at first because it can kind of irritate the knee, and then left foot forward. If the knee is good, you can increase, but again, we want to add weight and make this harder over time. Level 2 versions of step up. So with the bench or table, place the affected leg up, keeping our torso upright, and using that glute, drive up, 1, 2, 3, pause, 1, 2, 3. And again, feel that glute, 1, 2, 3, pause, 1, 2, 3. Lateral wall slide with one hand on the wall with your foot on a slider. If you don't have this, you can use linoleum and a washcloth. We're going to press out, 1, 2, 3, pause, and back, 1, 2, 3. Work up to 12 reps. If this is too easy, you can add a resistance band or go slower. Some clinical tests that can be really helpful with knowing if this is a condition you suffer with is, again, those single leg loading exercises. So stairs, walking, jumping, and running. Does that cause lateral hip pain? The fader and favor, which are 2 orthopedic tests, should again reproduce your pain on the outside of the hip. There should be tenderness with palpation of the greater trochanter, so that big bone on the side of your hip, if you press on it, is it way more painful than the other side? And then lastly, standing in a single leg, does that cause pain within 30 seconds or weakness? With tendon rehab, some discomfort and pain is expected, and this does not mean you're causing damage. If you have like a sciatic nerve or acute back pain, you don't want to push through the pain because you're going to cause more damage and irritation that way. With tendon rehab, there's going to be some discomfort. It's expected, and you absolutely have to reframe your mind from this is more about strengthening things and I'm not harming myself. Some helpful parameters is the pain should be mild. So for reference, we're going to say 4 out of 10 on that oral pain scale. 4 out of 10 or less is mild. Anything more than that is too painful and you should dial back the intensity. Any elevation in pain should be gone within 2 hours after the exercise. And the next morning, you should wake up with baseline pain. So the pain should not be elevated from the previous day exercises. Lastly, we're going to talk about this amazing podcast by Alison Grimardi. She's a world-renowned therapist out of Australia. And she made this amazing podcast where she talks about gluteal tendinopathy and some important facts and things to treat it. And everyone that I recommend that listens to it always find it beneficial. I highly recommend you listen to it, and it's in the description below. Thank you so much for watching our video on gluteal tendinopathy. If you found it helpful, please like our video and don't forget to check out our other channels.